So beyond the first four major classes of lipids, there are several other functions and classes of lipids. And there's, first of all, the non-membrane functions of lipids. First, what I want to bring about are the signaling lipids. Now, eicosanoids are an example of these signaling lipids. I'm going to go into those in just a second, but what they do is they mediate inflammation, fever, and pain responses. Steroid hormones are also examples of signaling lipids, and they act as chemical messengers. Now, to give an idea of what an icosanoid is a 20 carbon long fatty acid. And essentially, the pathway for an icosanoid to be produced, specifically arachidonic acid, is there's going to be injury, which causes the cell membrane to be injured. That's going to release, with the help of the enzyme phospholipase A2, arachidonic acid. Arachidonic acid can go in one of two different major directions. One way it can go through lipooxygenase pathway, in which case it'll lead to leukotriene production, or they can go through cyclooxygenase pathway. And that can lead to production of things like prostaglandins. Now, to visualize that in a slightly different way, here on the right-hand side, we have the formation of arachidonic acid from the injury to a membrane. Now, that phospholipase A2 is still going to be involved. It's going to release that arachidonic acid. And then if it goes through the cyclooxygenase pathway, these COX-1, COX-2 enzymes, cyclooxygenase enzymes, they're going to take arachidonic acid and basically go through some chemical modifications to produce prostaglandins, prostacyclin, and thromboxane. Now, what I want to bring to your attention and what's pretty cool about this is that your non-steroid anti-inflammatory drugs and aspirin are examples of inhibitors of these. So the way that I always kind of think about this is that if there's arachidonic acid that is present in your bloodstream, it's going to undergo these modifications to make these compounds that make you feel not very good, that give you a fever. Well, that role, or the role that aspirin and your non-steroid anti-inflammatory drugs are going to play, is it's going to prevent that from happening. So that's a way in which lipids are going to act as communicators. Now, your lipid cofactors, another example of the non-membrane function of lipids, is that you have lipid cofactors. Ubiquinone is one, and it is an example of an electron carrier. So there are two major pathways in which these are involved. There is the electron transport chain in what is known as oxidative phosphorylation. And then there's also the electron transport chain, ETC, in photosynthesis. Now, the lipid cofactors and the molecules that do this are different from one another, or they're slightly different from one another, but they are effectively the same. They're both lipids, and they both act as electron carriers. Then you've also got pigment compounds. Vitamin A and vitamin K are examples of pigment molecules.